Okay, everybody quiet down a bit now. It's so wild. Now stop him. What's wrong back there? Who's screaming? Amy, you all right? Amy's hurt. Chris, please help me. Go find a policeman. Amy is hurt.
Officer!
Yes, sir.
Officer,
Yes.
quick, we need help. There's a girl hurt out there. We don't know what to do.
Okay, we'll get you some help.
Okay.
Let's go.
We need help. She's been hurt. I think she hurt her arm.
Oh, yeah, I can see that. Just a minute, I'll get you some help. You'll be all right.
Thank you.
Route 1 to Melrose Control. Would you please send down the Melrose Fire Ambulance to Main and Grove Street, and also send the accident investigation team. We have a young girl, possible broken arm, in a school bus here at Main and Grove.
Received. Car 87, respond to Main and Grove. Bus accident, little girl hurt. Fire rescue will be called.
Okay.
Fire department, Sherrick speaking. What's that? Grove in Maine? Okay, we'll send them down.
Andrew one is up at the store.
Attention,
Everyone, you are.
attention to rescue, attention to rescue. Respond. Grove Street and Main Street for a child injured on a bus. That's the rescue to Grove Street and Main Street for a child injured on a bus.
Hi, I'm Dr. Glenn Gleesman, and I work at the Melrose Wakefield Emergency Department. We're a very busy place, and some days we see over 100 patients in one day. That can mean over 33,000 in a year, and they're all ages, from the very old to the very young. Some are your age. What should you do when you need help? Well, the police and fire departments are usually waiting for your call. Sometimes there's a policeman close by. They'll respond in a matter of minutes, usually, and when they do, they'll take control of the scene, help out with first aid if that's needed, and call for more help. Let's go on with our story.
Hi, what happened?
Okay. I see a bruise on your chin. Did you hit your head? You knocked out at all? Did you hurt any place else? No place else? Okay. Let me take a look at your arm. Can you feel this? Feel my fingers? I'm going to put a splint on your arm and put it in a sling. Okay, take it to the hospital, right?
Melrose Wakefield, Melrose Wakefield. North Shore CMed calling with an entry notification from Melrose Fire.
This is Melrose Wakefield standing by. CMed, go ahead.
Stand by, Melrose Fire, for the Melrose Wakefield.
Thank you, CMed. Go ahead, Melrose Fire.
Yes, we have an alert female patient, age 7. Patient was playing when she struck her chin and right arm. There was no LOC. She had an abrasion on her chin and some swelling and deformity on her right wrist. Her pulse is 76, BP is 100/60, respirations are normal, and pupils are equally active. We have a padded board splint on her right arm with a sling and a dressing on the chin. She doesn't have a doctor or any previous medical history. Her ETA is approximately 2 minutes. Is there any questions?
We have no questions, Melrose Fire. Melrose Wakefield out, awaiting your arrival.
Ambulances come in all shapes, sizes, and colors. Some even fly. But one thing they have in common is that they're full of special equipment and the people who know how to operate that equipment to help you out. EMTs, or emergency medical technicians, receive a minimum of 121 hours of training. Paramedics train even more, with 1,500 hours of training before they can be certified. Now, with all these ambulances and all these hospitals, somebody has to keep track of where everybody's going. In our area, Boston CMed supervises where the ambulances go, making sure that for your emergency, you get to the right hospital as quickly as possible.
Hi, honey, what happened to you? You hurt your arm. Does anything else hurt you? Okay. My name's Pam. What's your name? Amy. Okay, Amy, I'm going to take you with me down to room 2.
Your next stop in the emergency room is at the triage desk. Triage means to sort out, and that's exactly what we have to do when you arrive. We have to sort you out according to who is most seriously injured and who has a minor problem. Once we've done that, we determine which room to send you to. Some rooms are very specialized. For example, one room might be just for eye problems. Another room might be for major trauma, such as in a car accident. Still another room might be for broken bones or orthopedics. Somewhere along the way, we have to be sure that we know exactly who you are. For example, there are over 1,800 Smiths in the Boston phone book. If your last name is Smith, we might have a hard time being sure who you are without asking the right questions. Once we know who you are, then we can find out if you've been here before, if you have a medical record, and who to call so that we can inform everybody who needs to know what's going on.
Okay, Amy, everything's fine. I'm just going to put this under your arm. So we can keep it elevated, okay? And that'll make it feel a little bit more comfortable. And we'll put some ice on it too, so it won't get all swollen, all right? I'm gonna give you a little buzzer. And if you need me while I'm gone, I want you to squeeze that, okay? And then I'll know to come back to see you. But I'm going to call your mother now, and she'll be down to see you in just a few minutes, okay? Bill, could you take a look at this little girl? There was a school bus accident, and she has an injury to her forearm.
Did parental consent?
I'm just calling her mother now, and I'll ask her to come and sit with her.
Great, okay.
Hello, Mrs. Gallagher? Yes, Amy asked me to give you a call. She's fine, but she had a small accident on the school bus this morning. And so she's here in the emergency department at the Melrose Wakefield Hospital.
One of the first things we have to do is to call your parents. We'd like to have their permission to treat you, and we know you'd like to have them there too. There might be some waiting after that for a number of good reasons. First of all, there may be sick patients who require care before you. And second of all, it can take some time to do all the work behind the scenes, lab work and whatnot. The team consists of several players. They're doctors, nurses, and others, such as a physician assistant or a therapist or a technician. And they'll all work together to try to make you better as quickly as possible.
Okay, Amy, this is where it's hurting the most, right down in this area. But you can feel me touching you down here, right? And you can wiggle your fingers, okay? Very good, okay. Let me just take a look at your chin now. Can you open your mouth up? All the way wide. That's good. Now just smile. That's good. Okay, we can take care of that too. But first we're going to get an x-ray of your wrist to see if it's broken. Okay? Hold on. Dr. Emerlian?
Hi, Bill.
I've got a 7-year-old girl who fell on the school bus. And she has a small laceration on her chin, I think. But she's complaining of a lot of pain in her wrist. There's some slight angulation of her wrist.
Oh. How's the range of motion of the hand?
The fingers are, it's okay, but
sensation?
the wrist, yeah, sensation's good too.
Good.
But the wrist is very painful, so
Yeah.
I'd like to get an x-ray.
Okay, yeah, sounds good.
Okay.
Yeah.
Can we get an x-ray of her right wrist, please?
Yes, you may. Okay, Amy, we're going to take an x-ray of your forearm. We're going to put a lead shield on your abdomen. I need you to put your arm out nice and straight. And now we're going to take the film. Try not to move. Okay, now Amy, don't move at all.
Sometimes in the emergency room, we order x-rays. Why do we need x-rays? Well, x-rays allow us to see right inside the body, right where we can find a problem like a broken bone, for example. Now, if you have a broken bone, we might have to do any number of things to fix it. But first, do you know the difference between a fracture and a break? Guess what? They're the same thing. Well, when we go to treat a fracture or a break, we use several different methods. One of them is a cast. You've probably all seen casts that go around the arm or the leg, made out of plaster or fiberglass. Sometimes we use a splint. That goes partway around. And other times when the break is really bad, then we go to the operating room and fix it with screws and plates and other hardware so that it works as good as new.
This is the little kid that I was telling you about, the 7-year-old in the bus accident.
yeah,
As you can see, there is a fracture there. So what I was going to propose is that we put a splint on, have her follow up in ortho in about a week. And
Sounds
about
good.
her chin, it turned out to be not a laceration, but just an
Oh, good.
abrasion.
Good.
So I was going to wash it out and bandage it up.
Sounds good.
Okay.
Okay.
Amy was lucky. She just had a scrape on her chin. But if it had been deeper, she might have needed stitches. We'd like to demonstrate how we do stitching or suturing on a part of a turkey, believe it or not. You can see that the cut is surrounded by towels. These are very clean and keep the germs away. The wound is cleaned again to make doubly sure that there are no germs in the area. Notice the gloves to keep the germs away. a special medicine is given as a shot under the skin in order to make the skin completely numb so you won't feel any pain with the stitches. Next, the stitches or suture material is removed from its special container. The needle is made out of metal and is curved and very small. And the thread is like fishing line made out of nylon. The skin is picked up, the needle is passed through, and a simple loop is made. Next, a knot is tied to close the loop. Most cuts need several stitches. Sometimes they have to be underneath the skin before the skin is closed. The knots are carefully tied to make sure they won't come loose. All the instruments are sterile so that no germs will get into the cut. Once the wound is closed, we'll have to be careful to look out for infection. If there's infection, it may start to hurt more. It may turn a little red, or there might be some pus coming out of the edges of the wound. It'll be very important to keep an eye on things as they heal. When the stitches have to be removed, it's a simple matter of snipping the exposed part and removing the stitch with no pain at all. The wound is cleaned one final time, and then we put on a bandage.
We'll just put a little Band-Aid on that scratch on your chin.
I'm looking for my daughter.
You must be Amy's mother. Come right down. She's in room 2.
It'll be all better, okay?
Hi, Mom.
Are you okay?
Amy's a wonderful patient. She's done very well. She has a little broken bone in her wrist here, and that's why we have the splint on. And she has a little scrape under her chin.
Bye now. Thank you.
Good. Nice to meet you. Bye-bye.
Amy went through a lot. You've seen that it takes lots of people to take care of an emergency, including people from police, fire, and the team in the emergency room. Sounds like it's time to get back to the emergency room. We hope you don't have an emergency, but if you do, we hope you'll find it a little bit less scary now that you know how everything works. Bye for now.
Eat your heart out, Martha Stewart. Happy New Year 2003.